Hi, I'm Dr. Tracy Marks, and I'm a psychiatrist, and I make mental health education videos. About 30% of people with schizophrenia continue to have psychotic symptoms even on medication. If you're not familiar with what schizophrenia is, I explain the basics of it in this video. Treatment resistant is when you don't have an adequate resolution of your symptoms after taking at least 2 antipsychotic medications that are not clozapine. And by the way, this is the same definition that we use for treatment-resistant depression. If your depression does not get better after taking 2 antidepressants that for at least 6 weeks, it's considered treatment resistance. The antipsychotics, though, tend to work faster than the antidepressants, so you may not need to take it for a full 6 weeks to determine that it's not working, but it needs to be long enough to give the medication a chance to reach steady state in your body, and you need to have what would be considered a therapeutic dose of the medication. So if you took a medication for 2 days and stopped it because it made you dizzy or it made you feel like a zombie, that medication doesn't count as a failure. That counts as medication intolerance. A 2019 study analyzed several research studies and found common factors that predicted that someone would fall into the treatment-resistant category. The most robust predictor is an early age of onset. And what's early age? The general consensus among studies was having psychotic symptoms or being diagnosed before age 20. The typical age that schizophrenia shows up is in the early to mid-20s for men and late 20s for women. But even though the psychotic symptoms may not show up until the 20s, about 50% of people will start having depression symptoms that later morph into psychotic symptoms. But delusions or hallucinations that show up in childhood or the teen years is usually a sign of a more serious form of schizophrenia that will be harder to treat later on. Other predictors were being male, being born in the autumn or the winter, and winter was considered December through February, and autumn, September through November. I'm not sure why that makes a difference. And then the last factor is poor functioning before the diagnosis. This is also called poor premorbid functioning. Some examples of poor functioning would be doing poorly in school, usually because of the disorganized thoughts. And I'm not talking about delusions. Schizophrenia causes cognitive problems like trouble with problem solving and analysis. Another example of poor premorbid functioning is having prominent negative symptoms. Negative symptoms would look like extreme social withdrawal and impoverished speech, decreased facial expressions, trouble reading body language and social cues. Impoverished speech is having little speech production. So this may look like a person who doesn't initiate speech, and even if you start the conversation, you may get one-word responses with very little details or very few explanations of things. They just don't have the words to express themselves. These negative symptoms I just described are not exclusive to schizophrenia. You can see negative symptoms with social anxiety, autism spectrum disorder, and other developmental disorders. They're called negative symptoms because they're an absence of something. A blank stare is an absence of a responsive facial expression. This is in contrast to positive symptoms like hallucinations or delusions that add something to your internal experience that's not supposed to be there. So how do we handle treatment-resistant schizophrenia? I mentioned that it's defined as a failure to respond to 2 non-clozapine antipsychotics. Clozapine is the strongest medicine that we have to treat schizophrenia. No other medicine has come close to the power that it wields in knocking out symptoms. So why don't we use it all the time? Because it has a lot of side effects, including the potential for massive weight gain, like on the order of 50 to 70 pounds or more. I talk about the negative effects of antipsychotic-induced weight gain in this video on metabolic syndrome. The serious side effect of clozapine is a low neutrophil count called neutropenia. Your neutrophils are one type of white blood cell that fights infection. If it gets too low, you can become overwhelmed with serious infection. And this is one of the causes of death in people who get chemotherapy for cancer. Many of the drugs wipe out your immune defenses. So with clozapine, we carefully monitor the effects of the medication with frequent blood tests. Your doctor will have to register you in a monitoring system, and your pharmacy won't even give you the medicine if you haven't gotten your blood work. The schedule for someone with normal neutrophil levels is weekly blood tests for the first 6 months, then every other week for the next 6 months. If everything's good and your neutrophil counts have been normal, then you can go to monthly after 1 year of monitoring. It never gets less frequent than monthly. If at any time your neutrophil count drops to below 1,500 micrograms per liter, you have to get your blood checked 3 times a week until the neutrophil count comes back up. Then you can go back to your usual schedule. So it's high maintenance, but it's powerful. I've seen a few people who were practically non-functional because of severe disorganized thoughts just clear up with clozapine. It was amazing. I'll never forget one person that I treated in the hospital years ago who had what we call word salad. Word salad is speech that's so disorganized you can't make any sense of it. Another term for it is schizophasia. A few weeks on clozapine, and he was talking in sentences that we understood. And his parents were overwhelmed with joy because they finally had their son back. They could communicate with him. If you can't tolerate clozapine or just don't want to deal with it, other treatments are electroconvulsive therapy, or also called ECT, repetitive transcranial magnetic stimulation, also called RTMS, and deep brain stimulation. ECT has been around the longest and has the best track record for improving schizophrenia symptoms. RTMS is still new and experimental, as is deep brain stimulation. Deep brain stimulation requires surgery, so it's pretty invasive, and we need a lot more information about its effectiveness before it becomes an accepted treatment. That's it on treatment-resistant schizophrenia. Check out my other videos on metabolic syndrome and understanding schizophrenia. See you next time.